So by the title of this video, you probably figured out already what it's going to be about. So basically, I'm just going to jump right in. Hello, I'm Dylan Lear, and I'm going to be talking about scoliosis surgery. Something I just had, kind of, recently. But this first video is going to be basically me talking about every little detail of what happened in the hospital, that entire experience, and then there's going to be another video I'm going to be shooting basically today, right after this video, about my first month post-op and how that's went. So let's jump right into this video. Basically, I'm going to try to make this video as short as can be, because it's basically going to be me sitting here talking to the camera and you looking at my mug face. So let's go and take a look at what I looked like before the surgery. It's obviously quite a lot. Right now I'm over 100 degrees of curvature, S-type curve. You're about to see. I'll relay some X-ray images to let you see, probably somewhere around here, and compare it to what it looks like physically. So with that, you'll be able to see really what I'm dealing with here and why I've decided to do it. So this is obviously something that not too many people have seen, obviously due to the self-confidence issue, but getting it corrected. So yeah. So anyways, so looking here, this is me standing in a normal position. You can see the curvature like that. You can see how my head's tilted. This is me standing as straight as I can. If you do a side angle here, you can see the twisting from the back. This right here is a normal. I'm trying to stand up straight, and you know, it's you know, it's pretty bad. We're not sure if it's genetic. Slight indications that could be due to my mother and father's situation, but there's also some suggestion of you know, birthing issues. It just could be just something random. We don't really know. We couldn't figure it out. But you know, so you can really see the if you look at it from the back, you can see the twisting there. It hurts just for me to lean over like this. It really stiffens it up and hurts quite a bit. Like, this is me trying to lean. This is as far as I can lean. On this side, it's obviously better because that's where the curvature is going. But you know, this is it here. You know, it's pretty bad. I mean, obviously I can't lean as much after the rods are put in, but it's just not good. So the doctor at first thought, oh, this section of your spine is fused. We're gonna have to cut that all up and then basically put in the titanium rod. But after the MRI and CT scans, we found out, oh, wait a minute here, it's not fused. It's just very tightly compressed. So that means we can do something called traction, which, if you've experienced traction, or if you're going to have traction, it is absolutely miserable. So basically what they did was they drilled 4 points in my skull. If you can kind of see it, so I run right here, here, and then here and here. Basically drill into your skull and put this halo on your skull, as you can see here in the picture. And basically what they did was they basically put weights that hung from this contraction, and basically the weights were pulling you. It's similar to being on an inversion table, except for this way you were able to lay in bed or sit in a special wheelchair, which was basically all I was able to do, because they didn't want me to be out of it for any sort of time, except for to go to the bathroom. That was literally the only reason I was out of it, or to transfer from the bed to the wheelchair. So here you see a clip of me directly after that. So it's been a while now since I got here. So basically I got here into the hospital, did the pre-talk, whatever, got IVs and all that fun stuff, and then I went into the operating room and got the halo on. Put me on some anesthesia, knocked me out for a bit. That was at like 7:30, and I woke up at about 9, I believe, and I was up since then, regaining consciousness and everything. So right now, as you can see, I have the halo on. It's weights pulling on it. I don't know where you can see it. Basically, I cannot move from the position I'm in, except for my arms and my legs a little bit. So I have to go to the bathroom laying down, eat laying down. Absolutely amazing. But right now I'm just waiting for them to get a room ready for me, and then I'll be transferred there, and hopefully they'll be better. But this right here, it's very painful. It hurts my head and my neck, and but so far no pain pills, which is good. So yeah, bloody too, but yeah, not too bad. Also had a meal, didn't taste too bad either, so that was pretty good. As you can see, I was kind of decent, and I immediately started taking pain medications after I shot that, because it hurt tremendously. I gotta tell you, it was just painful. It's pulling on your head, so your skull was just squeezing and pulling on your skull, and then your neck was just absolutely horrible. I mean, it's just like stretching it. It was terrible pain. So then I was on morphine and Percocet and Valium and all that fun stuff. Terrible stuff for your body. I'll get to that later. But anyways, so I had a little bit of mobility. So I was in that from May 3rd to basically May 10th for 1 week. And during that week, it hurt quite a bit, but wasn't too bad. So I was in it about as much as you can be in it with being on all of those medications. And that being said, I really wasn't productive. I was on my phone, and I rolled around a bit in my wheelchair, and had friends over, and yeah, could have been worse, I guess. It did get worse. So that's where. So obviously I had my first surgery May 3rd, which was putting in the halo and putting me in traction. So then was May 10th my second surgery, so to speak. And so this surgery kind of depended on how the traction was doing. And traction, after the first week, right before the surgery, they took an x-ray the day before, and they got me down to 80 degrees from a little bit over 100. So that's not bad in a week. It could have been better, I suppose, but with what they did, about 40 to 45 pounds, well, I'll take that. So the second surgery, that was what they did was they took one of my ribs from up here, they cut it, then they removed discs from the worst section of my scoliosis, but the section up here, if you refer to the original x-ray, which is right here, cut the discs there, then they put the section of the rib that they cut out, and basically fused those the vertebrae together. So basically they did that, and then they put me back on traction with more weights. So I was up to 45, I believe, after that. So, yeah, if I remember correctly. Granted, I don't remember a lot because, well, I was just, it's just so painful, and, all that is just like I was out of it the entire time. Which you will be too, trust me. It's a lot of medication, ugh. So that was more painful, because now I had traction, and my spine hurt, and my rib cage hurt, because basically they cut out a rib. So after that surgery, literally all I did was lay in bed or watch TV or occasionally get in my wheelchair and roll around a bit, but that didn't happen too much. Happened a little bit, but didn't happen too much. It could have been worse, I suppose. So after that surgery, I did get on more medication, which, believe it or not, is possible, until May 17th, which was my next surgery. So before I get to that, I'll just go to timeline. So I did these incrementally on Wednesdays. So Wednesday I had the surgery. I would wake up from the surgery, remember barely anything, go back to sleep, and it would be Thursday. Thursday through Saturday was kind of just like, I'm out of it, miserable, kill me mood. Sunday, Monday, Tuesday, it was like a slow rise back up to, I'm okay. I'm, feeling miserable, but I'm managing. And then Wednesday I would have the surgery, the next surgery, and it would just be right back down. So then came the last surgery, which was, oh, that's the main surgery. So they took pins and drilled them into my vertebrae, and then they put in a titanium rod, and then they sealed me back up and sent me on my merry way. So that was May 17th. Let me tell you what I remember of that day. I woke up.
Redacted information.
Then I went down to the operating room. They sedated me. It was about like 7 in the morning. Then I woke up at like 5 or 6 in the afternoon.
Redacted information.
Was awake for about 2 hours, maybe an hour to 2 hours, and then fell back asleep. And then it was Thursday. Thursday, I woke up, and then they got me to walk around a bit, as you can see in this photo. I looked amazing, as you can see. It was fun stuff. You can see my back there with all the bandages and whatnot. It's rough stuff right there. And on Friday, they measured me and put me in a brace, which you'll see me show off here in a minute. I was able to have a physical therapist come, and we started walking around a little bit and did a little bit of exercises, and that was good. And so basically I started walking around a bit. And it you know, I had to push myself. It was like, I gotta start walking, I gotta start moving around, or else, well, I'm not gonna, you know, I can't, because throughout my entire stay in this hospital, I was losing weight and not working any of my muscles, and, you know, I was just becoming like a pile of filth. So it was pretty rough. Checking my special notes here on my notebook. After that, you know, it was extremely painful, and it was very interesting. It was, I believe it was Thursday. They had me on, they had me on a bunch of IVs, but they had me on like a morphine pump IV, where basically I would hit a button every 10 minutes and it would inject me with morphine, because I was on morphine, Valium, Percocet, and probably something else that I don't even remember. And, you know, I was taking Percocet 20 milligrams with 650 of the Tylenol active ingredient every 4 hours. That's quite a bit, plus the morphine every 10 minutes, however much that was. So you can imagine that is just knocking you out. And then Valium every 8 hours. And it was interesting because I was doing the morphine shot, and I just experienced this major chest pain where it's like I literally felt like I was having a heart attack. I called nurses. I was like, I was panicking. I was like, what is going on here? What, just help me, please help me, something. And, you know, so they started doing all these tests on me, and they're like, no, you're doing just fine. I was like, what's going on here? And I was like, and it clicked. I was like, it's just like, can't snap. It's like, it's the damn morphine. I gotta get this out. I just gotta stop. And I was like, take this morphine out of me. Just stop. I'm quitting it now. Cold turkey. Done. Move. And they were like, well, we can't get it out of you, blah, blah, blah. I was like, alright, whatever. So I took that button, threw it away, and I was like, well, it's still in me, but, you know, it's not getting in me. And, yeah, so I quit morphine cold turkey. It was on Percocet. And then, so that was Thursday, Friday, Saturday, Sunday. And then Monday, reference to this was done at the Norton Leatherman Spine Center, downtown Louisville location. I got moved to the Fraser Rehab Center, which was literally a block away. And I got moved there, and got settled. And my first night there, I guess part of it was, you know, I was trying to decrease my Percocet amount because, you know, drugs are bad. And it was just absolutely miserable night. Like, truly miserable. Like, I couldn't sleep, agonizing pain, etc. So the next day, started my physical therapy, and I was like, you know, I'm not doing too bad here. Feeling pretty good. Could be worse, but I'm feeling pretty good, with everything considered. It wasn't even a week after my surgery, and I'm walking around, kind of. And they're like, oh, well, you know, we got to be careful because of laws, and we don't want to get sued, etc. So I'm like, okay, that makes sense. You know, so I pushed myself, and I pushed the physical therapist and the occupational therapist. I was like, look, give me the green band so I can basically be free, do whatever I want, with limitations obviously. And they're like, you know what? Okay, show me what you got, and I show them, and and then by the end of the day, Wednesday, got my green band. So what that meant was I was able to put my brace on by myself, because they were like, oh, we can't let you sit up without putting on the brace, even though I've watched and researched plenty of other scoliosis videos where the people were standing, sitting, doing everything within days of having their surgery and not needing a brace. For whatever reason, I'm having a brace, which I don't blame them, because, you know, it's some more support, and it's, you know, providing more support for my spine and helping me and whatnot, blah blah blah, which, you know, it sucks I have to wear a brace, but could be worse. So anyways, so originally they're like, oh, we can't even let you sit up without the brace, and then it's like, okay, you can sit up, and, you know, so basically I was able to put on the brace, walk around in my room, and if I wanted to leave the room I had to use a wheelchair. And then whenever I was doing physical therapy, we would basically walk for an hour, so we walked a mile. And basically I was discharged Friday afternoon, so I wasn't even in there for a week. And it's pretty good, I guess. Impressive for me. I don't know. Yes, no, maybe. But anyways, so Friday I left and I went home. But anyways, so that was basically my surgery experience up until when I got home. Yeah, it was quite the ordeal. Painful, to say the least. So just to recap, halo. Week later, ribs, discs, fusion, halo again with more weight. Week later, rods, fusion, dismissal. And that was it. It was that was a lot. You know, so right now I'm here. This is gonna wrap up this video. If you want, I'm gonna upload another video either right after this video or a week later, depending on when this gets uploaded. And that will show my 1 month post-surgery progress, along with my brace, my scars, not just the photos I overlaid here, but like actual, like I'm gonna take off my shirt and everything, and just how I look standing up and whatnot. And yeah, which means you'll have to like watch this video and then open up another window and watch the next video to compare it side by side, but that's not my problem. That's your problem. Anyways, thanks for watching. Hopefully this was helpful. I'm going to have more videos about this, and hopefully it'll help you make a good decision. And right now I'm still honestly figuring out if it was worth it. Honestly, I don't know. But we'll see, hopefully.